All right, what's going on, everyone? It's Dr. Jordan Seda coming to you live from New York City. Are you ready to go to health and back? All right, let's get it. Beautiful people, I am fortunate enough to have one of my good friends and mentors, and there's a lot of other things I can say to laud this guest for what he's done to my in my career and what he's done to many patients in New York and beyond. I have Dr. Clinton Lee, DPT, Mr. Awesome, father of Caitlin Lee. What's up, Clinton?
What's up? Thanks for having me. This is my first podcast, I believe.
Yeah, and that's kind of hard for me to believe because you've been in the game for so long and you kind of pioneered what I consider a pioneering of powerlifting rehab and performance here in New York City. So I'm honored to be your first host, I guess.
Oh, pleasure's mine, man. I appreciate the kind words.
So I kind of skimmed the surface because I just want to get to the nitty gritty. Like you're a physical therapist, you specialize in powerlifting, you've competed in powerlifting. You're also just tell people who aren't familiar with you, like you know, about your business, what you do, what you're doing for fun right now. Let's just get right to it.
Yeah, sure thing. So, my name is Clinton. I'm a physical therapist. I am the owner of a private practice called Physio Strength. I work one-on-one with what I like to call, like, I'm going to use air quotes here, recreational athletes, and particularly in strength sports. So I work with a lot of powerlifters, some CrossFitters, some weightlifters, and everyone in between. Like you mentioned, Jordan, like I'm a powerlifter myself. I'm currently on a little bit of a hiatus. You also mentioned I have a daughter named Caitlin, so I'm a new father, and haven't been like powerlifting in recent months because I've been busy, but definitely plan to return in the future. And yeah, so I guess I first got into this niche, I'll call, of physical therapy by kind of being like interested in powerlifting myself back in, I'd say, 2014 or so. I had just finished a season of Dragon Boat, which I can explain what that is later, but I finished a certain sport and I was looking to, pick up something new with my free time. And, we were doing some strength training for that particular sport. And I loved, squatting and deadlifting. Didn't really get into bench pressing until I was, like more formally training in powerlifting. Yeah, and then so I got more interested in it. I did some competitions. I got powerlifting coaching through Sean Collins of Sincere Powerlifting. Shout out to Sean if you happen to see this. Excellent coach, and he pretty much familiarized me with the ways of powerlifting, and yeah. And then I guess I started working with similar athletes, I guess, just by being in that community, which I have to credit to Sean and other individuals that I met who were in the scene at the time. At the time, I didn't really like set out to be a powerlifting specific physical therapist, and even today, I don't know if I would necessarily label myself as such. I like to think of myself as like a physical therapist who happens to powerlift and loves it. And like I said, like being in the community of like the New York City kind of like barbell community was, very instrumental to kind of me getting into, this niche. So yeah, that's basically it. I'm currently, in my office at Squats and Science, the Williamsburg location. For those of you who don't know, I have space within the Squats and Science gym. Previously, I had an office in Soho, which was great, but I really love being like kind of like the in-house physical therapist, where I'm surrounded by strength athletes, so like strongmen, like I mentioned before, weightlifters, powerlifters, and it's been awesome. I've been here for about a year in this particular location. And yeah, and the rest is history.
That's wild that you've already been there for a year. I remember when you were closing shop in Soho, and I think I'm definitely healthier now that we don't work together in Soho because I'm not surrounded by all the amazing restaurants on Mulberry Street. But
Have you been back to Parm at all in
I
recent
have,
months?
I think I went there about like 4 or 5 months ago because I always try to tell everyone that spicy rotini hits different.
Oh yeah, I haven't had that in a minute. I missed that.
There's still
Yeah,
time to get it in before the end of 2021.
that's true. I can't even remember the last time I had it. It was, I don't even know if it was in 2020. No, it was in 2020 because you treated me to lunch one time. So yeah, that was definitely it.
I remember definitely having that brownie sundae, which they don't have anymore, regrettably.
That's off the menu?
I think it's off the menu now. Yeah,
That's so sad. Oh man, they got to
there
bring
was
that
nothing.
back. That was awesome.
Yeah, there was nothing sweeter to get me over a breakup than a brownie from Parm.
Uh,
That was sweet. But anyway, so you have a pretty successful business at Squats and Science in Williamsburg. You immerse yourself in the community now. From when you started as a physical therapist working with barbell athletes to now, have you noticed any changes in either your clients' approach to rehab or their expectations and or recent advances or developments in the treatment of barbell athletes?
yeah, that's a great question. I've seen like a positive kind of change in the community over the past like several years, at least from what I can observe. Um, I would say around like when I first got started around like 2014 or so. I think there was a lot of like, again, this is just kind of like in my subjective personal experience. I came across a lot of like bro science and kind of like these old school narratives that I feel like don't really apply to, you know, what the current evidence says about injuries and musculoskeletal rehabilitation. Um, but you know, that was 7 years ago now. I think the amount of information that's available online, like through awesome organizations like Barbell Medicine, for example, jumps to mind. Clinical Athlete, which I was a member of for a long time, has really done a good job of disseminating information that, you know, dispels all those old narratives and stuff that isn't true. And you know, again, something I love about like the powerlifting community is there, when you love a hobby and a sport and you really dive into it, like you're not just like, you know, training a lot, you know, which is certainly the case, but you're like researching a lot, like really looking to, you know, improve every aspect of your training, you know, and I think seeking out these sources that I mentioned before have been like really good at just kind of like dispelling those old narratives and stuff. I also have to mention Level Up Initiative, which Jordan, I know you were a mentor for you know, a couple of cohorts, and which I later on became a cohort for. So for those of you who don't know what Level Up Initiative is, it's this organization that was built to kind of help clinicians and physical therapists and healthcare providers just really have like this forward thinking kind of approach to healthcare and to be like good critical thinkers. And a lot of the work that the Level Up Initiative has done is kind of like consistent with those other organizations that I mentioned, like Clinical Athlete, you know, Barbell Medicine. And yes, I think organizations like that have really empowered clinicians, and you see the difference too. Like conversations that I'll have casually with people, like, you know, they'll talk about things that, you know, in 2014, 2015, I feel like it was just kind of like niche, like, you know, conversation amongst physical therapists. So I'm seeing like, you know, less just less of the BS, I guess, for lack of a better term, and a little bit more like kind of forward thinking and more like current concepts of rehab.
Yeah, definitely. I have clients that question me often about different methods of barbell training. Like I don't sure you're familiar with West Side Barbell training, but I remember I had two clients like, what do you think of that method of training? So, at the moment, it's really difficult to say like, well, if something works so well and is better than the rest, and I think everybody would be doing it, so you kind of have to do like a compare contrast pro and con situation. But clients are definitely more well informed coming into treatment now, and if they're paying, for both of us, it's cash based or out of network, like it comes with a little bit more expectation to be able to have that uh, more intelligent next level dialogue with them. So I find that pretty interesting, but it also helps me develop my craft and have to hit the books a little bit harder.
Yeah, yeah, definitely. You said it. Like being in the one-on-one, like cash-based or out-of-network models that we're in, like it kind of self-selects for people that are really willing to not only invest like financially into like a rehab session, but also like they like you said, they do their homework. Like they come in with detailed questions. They a lot of times they read similar like blogs, or they know of certain like research articles that once again, like I felt like only physical therapists and clinicians kind of talked about. But yeah, it definitely, like you said, it definitely sharpens us too. Like you got to come correct when you're dealing with clients that really love what they do, and they do all the research behind their sport. So yeah.
Sure. And I think this is a good time to transition into. So we're both in the cash based, and I know a lot of people don't like to use that term cash based because most businesses in the world are cash based. I like to think not many of them rely on health insurance to pay the bills, but because more practices like ours are emerging, I've seen a lot of student physical therapists and entry level physical therapists starting to jump right into being business owners themselves. So if there are any younger PTs or personal trainers or any other allied, basically anyone who wants to start a business in healthcare and performance, what are your thoughts or suggestions you might have for a younger person who wants to get going with this?
So I feel like my answer to that has changed a couple of times over the past several years. You asked me this question, let's say 7 to 10 years ago, I would have said like, don't do it right away. Pick up experience. Work in certain settings where you can get your reps in, see a wide array of patients and diagnoses. I still think there are obviously like lots of benefits to having that approach, but I think some people who are very entrepreneurial minded can be successful kind of going right into a private practice. That being said, like I think there's a lot. So when I went into private practice, which wasn't right away, it was kind of like 4 years after I graduated. I think I took for granted like how much just like all the benefits that I could have from working for an employer and like utilizing continuing education and like just using that time to learn as much as possible. Because when you're a business owner, not only are you potentially having like a very large caseload and you're responsible for obviously delivering excellent care, but like you're covering your own continuing education, right? Like if I was fortunate enough to be married at the time that I went into private practice, so as far as health insurance went, like I'm fortunate that I was covered under my spouse's plan. And at the time I didn't really regard how much like back end behind the scenes work there is. So I think people think it's like, oh, people look at it as going into business right away as like they look at the final, the amount of money that they're making, which it's obviously going to be a lot more if you have like a certain amount of clientele, but there's also a lot of things that you're giving up the luxury of having to, like those things I mentioned. Yeah, but I think today certain people can certainly do it. I as long as they know like the opportunity cost of going into your own private business. Like you might have to niche down, right? Like you may not see a diverse number of patients if you work in a particular setting. Like me, for example, like I work with a lot of barbell athletes. I see a lot of like overuse injuries, like a lot of chronic pain, some acute injuries. I still see a fair amount of like, you know, patients recovering from surgery, but not as much as I was like, you know, prior to going to my own business. And I'm not gonna lie, like I like keeping that part of my practice like kind of sharp. So yeah, I think at the end of the day, you just got to know like what you want out of your career and what it takes to get there.
Yeah. And I think I can only speak from my experience, but I think this is uniform across the board. So I had the opportunity to start my journey with Clinton as his employee. And that exposed me personally to more of the clientele that I was looking to work toward treating independently. So I started to get exposure without I don't want to call it a burden, but it was, the burden of running my own business and having to do all the recruitment for getting clients. So I was able to get my foot in the door, and luckily I had a mentor like Clinton. I guess in some ways, I guess the mentorship never ends, even though we're not working together that closely anymore. But having someone show you the ropes, understand what it's like to operate in this model, so you don't have to dive head first. There are stepping stones to getting there. And I think working with Clinton was a good one for me. By the way, Clinton, are you still looking for somebody?
I am. I'm considering like a couple of people, which I have to get back to. Now that you remind me, that person actually emailed me today too. So, but yeah, I am. Can I use this as an opportunity to to advertise?
Absolutely, I encourage.
Yeah. So if you're in the New York City area, preferably if you have 3 years of experience, I'm looking for someone to work on a per diem basis to kind of assist me with seeing patients in this location, in my Williamsburg location. Just email me. Good opportunity to grow within this practice, if you want to work one-on-one with barbell athletes and have the autonomy to do what you want in a 60-minute period with a patient, this might be the job for you. And I'm looking to grow this role into a full-time position one day. So
yes,
that's my plug. That'll be my only plug for the session.
That's a great plug. And I have at least 3 of Clinton's shirts because not only are they comfortable, but I enjoy working there so much. I don't want this to be like a Gaga fest for Clinton Lee and Physio Strength, but certainly a positive, more than positive step in my career, and I highly encourage people to jump on this opportunity. I think it's a rare opportunity that won't be there for long. Let me just say that.
Thank you, man.
Yeah, definitely. So we banter often about things that we've seen in rehab. I actually saw something yesterday about like a prescription that said no heavy lifting, you have to sleep in the fetal position. This is where someone with a low back injury, and I was like, how far back, like, are we in the 80s telling people not to lift, to have bed rest during, with back injuries and stuff like that? But what is like, let's just talk about like a few common things that people are told not to do that probably might be healthy for them.
Yeah. So you mentioned one of the big ones, right? Like occasionally you'll see a prescription from a physician or an orthopedist or whatever it might be, like putting some sort of what we both know are kind of arbitrary restrictions on like exercise. And it's frustrating because like that kind of response just says like, oh, just stop doing any type of exercise and then you'll get better, which isn't necessarily the best approach. in my, again, this is an anecdotal subjective experience, but like, patients that tend to just lay off of everything and they're fearful of moving. They get kind of fear mongered into thinking they might make things worse by like doing some sort of exercise or movement. But as you and I both know, like this is what we do. Like our job is to kind of find the right dosage of exercise to bring someone back from a painful state. So it is frustrating sometimes to hear like prescriptions and orders like that, because it just reminds me of like the gap there is between not only like within the physical therapy community, but like between disciplines too. Like it's so hard to, like, have you ever been in a situation where like someone comes in to see you, Jordan, with like they're hanging on to the words of an orthopedist, or again, not orthopedist specific, but like any other healthcare provider, and they're afraid and they're so caught up on that restriction that it's so hard to get them to do anything. And now you're trying to like sell them now when it's, it just makes the job a lot harder.
Yeah, definitely. It happens often where people either see a well-regarded physician in a hospital for special surgery. Here in New York is a reputation and everything else that I speak about. But those individuals are definitely hard to affect change with, especially if it's like they've seen a bunch of physical therapists already who haven't helped out. Then it's like a climbing Mount Everest. Although I think I'm built for it, and I think you are too. And that challenge is something we embrace for sure.
Yeah.
I had a client recently. I'm actually in the process of writing a blog about this, but he tore his ACL. He wants to walk his daughter down the aisle at the end of the year, so he doesn't want to have surgery. And he's like working with a personal trainer who is studying like muscle activation technique, or MAT. So it's like there's value in that, but for someone whose goal is to restore knee extension and get his quad stronger, for someone to be like, I think you should do clamshells because clamshells will help stabilize your glute, which will help you while you're walking. I'm like, that's like maybe tertiary or fourth on the list of most important things, where we don't have to see people. We have to isolate certain muscle groups. We have to squeeze our core and do all this stuff, where I think there's a time and place for all those things to happen. I think that's one of the things that people fail to realize, is that just because theoretically one thing might help something else is not always the case.
Yeah, for sure. Like, and I think personal trainers can be like a helpful alliance in the overall care of someone, but when someone has like an acute injury like that, especially like something like an ACL tear, the timeline is crucial to regain like certain things, and it's kind of frustrating to hear. I don't know if frustrating is the right word, but maybe it is. It's frustrating that I feel like physical therapy, like going to a physical therapist, should be at the forefront of that person's mind, and sometimes it isn't, unfortunately. Wow, muscle activation, I haven't heard about that in like 10 years. Like, I feel like a lot of Equinox trainers used to have it, or maybe they still do. I guess I don't really, train. Man, I remember that too.
Yeah, man. It's there's a lot of things. I'm sure there's a bunch of Rolfers still out there somewhere, and it's starting to die out. But I know that like Feldenkrais still exists in certain places, and you get a bunch of people walking like they're holding a walnut in their ass cheeks.
I actually don't mind Feldenkrais that much. At least like the people that I've seen with like a performing arts background that like have had some experience with Feldenkrais, like only in the sense, like the reason why I like it is because they have like good awareness of their body. And again, I have a small sample size of people that I've worked with who have had like Feldenkrais experience, but like they're at least like they're aware, but they're not super sold into like some sort of underlying like BS narrative, like Rolfing, for example. Like I, I feel like the whole 12 sessions of Rolfing, and then so we can address like these objectives. Like you have to necessarily do 12 because this is what Rolfing does. I'm like, that's such a transparent like sales pitch to me, so
Yeah,
um
I feel that. But I'm also a big proponent for not having podcasts that run hours and hours because people probably fall asleep. What I definitely want people to get from this, you work a lot with barbell athletes, but how about if someone in general is on a mission, they're recovering from injury and they want to achieve some fitness goal of any sort, whether it's to lose weight or get more tone or compete in powerlifting, what would you say would be like one of the major takeaways, one of the key points into being successful on that journey?
um I would say be in it for the long haul, right? um I hate to use the cliche, but I think certain cliches are cliches because they're true, and there's like some sort of fundamental truth to it. So think of like your health as this long-term investment. It's a marathon, it's not a sprint, right? Even if you get better like a fraction of a percent like in a given week or something, right? It might feel extremely slow, and ultimately your end goal may be to hit like this number on a back squat, and you're focused on that number, and it's a hard kind of approach to take, I think, because um it's I feel like it's more beneficial sometimes to have like these process oriented goals and to just kind of fall in love with the process of getting better little by little. So it's much easier said than done, but I think patience and being long term minded will lead you to success, and there's delayed gratification in it, and it'll be worth it. Something that I try to tell a lot of people, whether they're patients or fellow clinicians that work out, it's like, you're, God willing, like we're going to be training for like the rest of our lives as much as is physically possible, right? So like if you get a fraction of a percent better, like every, I don't know, several months until you're whatever it might be, like 70 years old or something, like just think about the benefits you'll get over that long term. So yeah, so just be patient, treat it like a marathon, delay gratification, and just put in the work.
I'm doing the snaps of approval.
Nice.
I'm into it. I'm into it, and yeah, I I miss chopping it up with you more often. We have some good conversations, and definitely going to continue the Instagram banter and sharing of thoughts and ideas for sure. But
Yeah.
say somebody wants to take you up on your opportunity to work with you, or wants to ask you any questions about rehab, powerlifting, your daughter. Where would be the best place to reach you?
Yeah, thanks. You can email me at Clinton at physiostrengthnyc.com. Yeah, just shoot me an email, and I'd love to meet with you and network with you, and see if you're the right fit. Yeah, let's do it.
All right. Do you have any parting words for the world, Clinton?
Whew, I don't know. I have some parting words for you. What are you up to later? Say it's Friday. Do you have any plans?
Not really, not particularly. I might. So I do capoeira, as you know. So maybe I'll play my bedding bow a little bit. Practice playing my instrument. My nose is healing, so I feel more confident. I don't know if you knew, as I broke my nose last week.
I did not know that. I'm sorry to hear
Yeah.
that.
Yeah, well, it was broken by somebody's elbow, even though it was like my fault technically. Um, so yeah, I had like a little bit of yellow stuff building up on the side of my eyes.
If it's any consolation, like I did not notice at all. I'm sorry to hear that. I hope it gets better like fast.
Yeah, that's what happens when you keep your nose in other people's business. Wink, wink. If someone didn't know who was the father, I'm sure people would guess it was me with my dad jokes.
You got your nose, just to confirm, you got your nose broken during practice, right? During training,
Yeah,
during
not a
capoeira
game,
training.
not a
Okay.
game, not a game.
Yeah.
Practice.
Yeah. Or like, I'm glad it wasn't like in a bar or something or on the street. You said someone's elbow hit you.
No, no. Although that would, I mean, if I had my nose broken, but then I gave it to somebody really good, then maybe that would have been a better story. But
No, I'm glad that's not the story.
yeah. Anyway, that's all we have today, beautiful people. I again want to thank Clinton for his time and insight. Now get out there and make shit happen.
Thanks for having me.